Hello, Revere, and welcome to our Revere Veterans and Community Show. Two great guests. They're from the Cambridge Health Alliance. I'm sure you know one of them, Miles Lyon Kennedy. Welcome back to Revere, Miles.
Don't get up. How are you doing, Morris?
It's a pleasure to have you back. And Miss Roberta Robertson. What is your title, Miss Robertson?
Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance.
Good. And we would like you to start the show off by telling us exactly what the Cambridge Health Alliance is.
The Cambridge Health Alliance today is comprised of the Cambridge Hospital, the Somerville ER, the Whidden Hospital in Everett, 12 primary health care centers, as well as the Public Health Commission in Cambridge. And I'd say in the last, within the last 2 years, Cambridge Health Alliance has an affiliation with Beth Israel Deaconess Medical Center as a Boston hospital.
And exactly what did they do? I mean, what's the Alliance really do?
Well, we do a lot of things.
Name each one.
Okay. Well, first of all, we take care of the most disadvantaged and the underserved folks. We have the primary...
Question number one.
Yes.
You mentioned underserved folks. If a person does not have insurance, can he still come into one of those hospitals? They
can. They would. You can't have no insurance these days, so there is a form of insurance.
Oh, there
but
is?
We have a department that would help them get on that. And for folks that haven't been in the country for 5 years or more, there's a Network Health, and there are only two hospital organizations that have this Network Health, and one is Boston Medical, and the other is Cambridge Health Alliance.
Right. And the other thing, what else?
What else do? We have primary health care centers. We have we have the Public Health Commission, so they're always doing promotions and flu vaccination, education, all kinds of things like that, vaccinations. And also we go out into the communities and we do a lot of outreach into the communities.
That's good.
It's truly a community hospital. They serve the people in the communities, honestly. And it's a community hospital, so the Alliance is not able to do everything at the community, which is why they have an affiliation with Beth Israel Deaconess Medical Center.
Right. I'm going to hop around a couple of questions here, which are on my computer. Number 3, what is your role there, exactly your role?
My role, I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance, and my role is to go out into the communities and to educate people about all of the programs the Alliance has for folks. They call us now older adults. It's much more forgiving. The boomers, the baby boomers, the baby boomers do not like the term elderly or senior, so now we're all older adults.
I love the word seniors. I do. I really do. Because, yep.
Well, you've earned it.
Well, I'm from the old school, so, it's an honor to be a senior, because if you're not a senior, you don't have any more worries. That's the way I look at things. So
Right.
I like to skip around for 1 minute. Miles, you used to be the Chief of Staff for Mayor Dan Rizzo, I believe.
Yes, sir.
And I want to thank you. You did a great job. You were great to the city of Revere.
I love Revere, so it's been fun.
And I want to thank you on behalf of the veterans and on behalf of the people of Revere. So thank you.
No problem.
What is your title, if I may ask, over at the Cambridge Health Alliance?
I'm in the communications manager in the marketing and the public relations department. So a lot of what I do is like internal and external communications. So I help with like a lot of workforce messages inside the organization. And then I also help to try to pitch stories and get stuff out in the public about what we're doing that's positive. Like we had a few new board members from Cambridge that were just appointed, so I work with local newspapers on that. Then I do all sorts of, small writing projects here and there too. So, I mean, when I was after Revere, it really was part of the reason I was drawn to CHA is because it is a public health network. I mean, you really are. I mean, you don't see it every day, but you definitely, like, once in a while you'll talk to a doctor or a physician who had a really positive experience with someone that needed health care. So it definitely is, a mission-driven organization, and so that was what was really important for me coming out of Revere, working with people on a daily basis, in constituent services. I feel like it's the same kind of thing, so it helps me sleep at night knowing I'm working in a good place.
That's good. I'd like to ask you a question as a veteran. I go to the VA hospital in Jamaica Plain or West Roxbury or on Causeway. Does the Cambridge Health Alliance, like if a veteran wants to go to one of theirs, would the Veteran Administration take care of it? Because I thought they passed a law that a veteran can go to any hospital he wants to. Has anybody ever mentioned that?
I'm not sure. It's a good question, but I'm not sure exactly.
I'm not sure either. I know that, so you're a veteran and you're covered under...
The VA, in other words, let's say that there's a hospital like Wooden that's right near me.
Right.
And Wooden, you mentioned, is part of the Cambridge
Absolutely.
Health Alliance, CHA. So if I wanted to go to Wooden, the VA would take care of the costs as if I went to the VA. Are they anything together on that?
The last time, don't quote me on this.
No.
I heard this on NPR, is that there's certain doctors that are affiliated with this program. So I think you have to be like inside that provider network, and then it would work. So I'm not sure exactly, but we can get back to you on that. I can at least look into it.
That would be nice. And if you let me go the next show I have, I'll make sure the people out there know. Roberta, I'd like to ask you a question, if I may.
Certainly.
How did you first get started? How long have you yourself been involved with the Cambridge Health Association?
Well, I just celebrated my 10th. I just celebrated my 10th anniversary last week.
Congratulations.
Thank you. So I've been here one whole decade. And similar to what Miles was saying, I take doctors out to the community. I bring them out. We do presentations. I do presentations. I have TV shows. I bring them on my TV shows. And every doctor that I have ever worked with, and I've worked with docs from foot doctors to brain doctors, every single doctor really cares about their patient. And that allows me to sleep at night and to know that I'm in total alignment with them, as far as providing care to the people that would normally not be able to get the care. Several of the programs that we have our primary health care centers that I mentioned, 12. We have doctors that are part of the Senior Care Option Program, which is a SCOPE program, which is a network, because we're all going to be in a network. That's where we're going. That's where healthcare is going. That's what's most cost effective and cost efficient. And actually, Mass Health is going to be moving people into these kinds of networks so that they can have someone overseeing all of their care, which makes perfect sense. But we partner with the SCOPE program. We have a senior program that in this area, the Revere and Everett area, Malden area, our docs oversee people in nursing homes. They oversee some folks in assisted living in Malden. And we also have a PACE program, which is a national program. Locally, we're called the Elder Service Plan of the Cambridge Health Alliance, but nationally, we're part of the PACE program of all-inclusive care for the elderly. And this program is for folks 55 and older who need assist with things like bathing and dressing, grooming, things of that nature. And it's an entire continuum of health and health-related services. Under certain income and asset guidelines, they don't have to pay a copayment for a doctor, hospital, or medications.
Is there any limit? I mean, or is just an income?
There is an income limit, but for no payment. But there is no income limit for enrolling. If you're over that income limit, then we enter into what we call a spend down situation, which is a little confusing. And if you have lots and lots of money, you can private pay the program.
Right. And
but the mission of the program is to keep people home and out of hospitals and nursing homes.
And that's for people over 55?
55 and over, yeah.
Right.
The older adults are getting younger and younger. Every day.
The way you're talking, we'll be disappearing soon.
I'm right with you.
Okay. Before we went on the air, we discussed a couple of things, and I would like you to tell the folks out there. One of them was the primary health clinic. Exactly what is that?
Well, there are several. We have one here in Revere,
Yep.
And they have expanded the program, and actually they have doctors on board who are open for seeing patients right now. So, and they do all kinds of health care there. It's a primary health care clinic, so you can go there for any issue that you might have, and they would refer you to a specialist, of course, if you needed one. They also
And it's located across from the Walgreens on Broadway.
Oh, yes.
Just down the street that way.
Right.
Is it 384?
Yeah.
I think it's 384 Broadway. So that's exciting, for us to be able to offer these all kinds of services to the folks in Revere and in other areas as well.
I would like to ask you a question, Roberta, if I may. If people wanted to get more information, can they contact the Cambridge Health Association?
They can. They can contact me if they like.
Do you have a number they can reach you at?
I do. They can. Do you want me? They can reach me at 617-835-1422.
And you'll answer any questions they have.
I will. I'll be happy to, and refer them. By the way, I am billed as the geriatric expert at the Cambridge Health Alliance for more than one reason, I think. But because I've worked in every aspect of elder services except for assisted living. So and fortunately, I've retained everything that I've learned. So if folks call me and they themselves or they have family or friends that need some assistance, I'm happy to listen to them and to make advise them appropriately. So what might make more sense for them to do.
And let me ask you, if a patient needs help and he's home, does the Alliance also provide them with a caregiver if they need that too?
We don't, but with the SCO program and with the PACE program, that's part of what we do under those two programs. The Alliance itself does not do that, but the programs do.
Right. And like certain hospitals major in certain things, like some of them are good in, let's say, in cancer, some of them are good in surgery. What is the Alliance Hospital? Are they all specifically have a major thing that they are good in?
Well, doing my TV shows, I've learned an awful lot about the Cambridge Health Alliance because I've had doctors on board, and I've found out that we are a stroke center. We are a breast cancer center, which is more than just going to a doctor's office and being treated for these kinds of things. Being a center gives you some accreditation. So those are things that I really didn't know about the Cambridge Health Alliance because I spend my life out in the field with the people.
Right, now I'm going to ask you some good questions, Roberta, if I may.
You're getting gunned over here.
Oh, they're going to be hard?
No, it's not hard, very easy. I don't know how to put it, but let's say if a woman, how often should a woman be checked for, let's say, breast cancer or for things like that?
Well,
even if they don't have it, at what age should they actually go in? And then for the male, prostate?
Well, for the women, I think the age is 40. And then they'll start the mammograms. Now, if there's any history in the family, they might start earlier, and they might check more often for the women. And then at a certain age, I'm not sure if it's 80 or 85, or even maybe a little bit younger, that if the woman has been cancer-free, then they stop the mammogram. There's no need for the mammogram.
Right. Now, for men who have, like, let's say...
Which is pretty torturous, by the way.
I believe that. For a man like prostate cancer,
prostate.
Right.
I think it would follow similar if there was any history in the family, but as men age, then sometimes the prostate enlarges.
Right. What do they mean by, like, I didn't go for a PSI test for 20 years. I should have gone, but I didn't go. And when they did check me, they found my count was 34. That's what's my count, which they say is tremendously high. What do they mean by PSI, if I can
It's
ask?
a test.
Yeah.
It's a test that they give to measure. I'm not exactly sure.
Is it the immune system that they check?
No idea.
Yeah, I don't know. That's, I guess, a question for a doctor, and,
right.
and we're not clinical.
We're not clinical.
Okay, then that's about it. Okay.
I know a little about a lot, but I'm not a clinician.
No, I was just curious myself because...
But I would always say that early detection is better than not going for 10 or 20 years, because the sooner the doctors are able to catch anything, the better chance you have of catching it and cure. And prostate cancer, by the way, can be 100% curable these days if it's caught soon enough. So we don't want to, put our heads in the sand and ignore things. We want to make sure. No,
because I know I go to the VA, and I know for the prostate they have like radiation, they have chemo, and they have what they call the hormones, where they shoot a radioactive pellet into the side of you, which is radioactive where the cancer is. So they have a lot of ways to keep the cancer from spreading. But they say it should, like my reading was 34, they said that was very, very high. When it should be down around 0. So that's what I thought it was. But every male should get their prostate checked. I think, what, over the age of 40 would be good?
Well, I'm not sure what the age is, but again, I would,
Right.
if there's any history in the family, you definitely want to discuss it with your primary healthcare physician. The primary healthcare physician today, by the way, I'm still finding people out here that do not have a primary healthcare physician, which is pretty scary because the primary healthcare physician is the navigator through the entire medical system. You can't go to any other specialist without a referral from the primary health care.
You're exactly right, and I'm living proof of that because I went to the Causeway and my primary care sent me to the ortho, to the dental, for an EKG. One thing I got to take, and I don't even know what they mean by that, is they took an EKG, but they want to go one step further and do an echo. What is the difference between an echo?
Echocardiogram.
Is there a difference between an EKG and an echo?
Well, there's a difference, and it's probably would show more the echo. My guess is that, but I'm not a radiologist.
Oh, okay. So that's what I want.
But the EKG is an average test. I've had one myself. They hook you up and they
Right.
take the reading. The echo is something I would think they would be able to see more inside.
Yeah, I have like a history of like a heart condition, so I get an echo like every 3 years.
You got one?
Yeah, I've had an echo. It's just they just take something and it's just like a
What do they do? Do they stick?
Ultrasound.
they just like rub something and it's like it just looks
They don't
inside
stick
your
a
chest.
pen or a needle into you?
No, it's just it's a more expansive camera basically.
They put a gel on it.
Yeah,
and
and they just kind of look
right.
around and see what's going on.
Oh,
You know, that's similar to when a woman is pregnant and to see the ultrasound for the
Yeah.
baby. That's the
Oh,
exact
yeah,
same
yeah.
thing that they do.
Yeah.
They have this wand and they put the gel on it, and they can see. You can actually watch it yourself.
Yeah.
Are you able to watch it when you?
I don't think the last time I had it was 3 or 4 years ago. I don't think I actually watched it. It was kind of creepy. So.
Oh. But, you know, I wanted to say one thing, if
Go
I
to-
may, as long as we're talking about primary health care providers, because if people do not have a primary health care provider, or if they're not happy with their primary health care provider, today you need to be able to talk to your doctor and make sure that the doctor is one that listens to you. You have to have communication with your doctor. Who knows your body better than you? And the Cambridge Health Alliance has a doctor finder service. Now, I'll give you that number as well. It's
give it to the people out
I'll
there,
give it to the
Roberta.
people. 617-665-1305. And they will find you a doctor and make your first appointment for you.
It's nice to have a primary care clinic right here in Revere on Broadway within walking distance. I mean, it's pretty good for people that live in the neighborhood.
And what was that address again you mentioned?
It's
Was it-
384, so it's just right next to the Walgreens on Broadway. So I mean, it's very close for people that
That's not what the old Fernwood used to be, is it?
I don't know, I
That
don't know.
building across the street?
I don't know. It's in between the Rite Aid and the Walgreens. It's right across
Oh.
the street. Yeah,
Right on the corner.
yeah,
Oh, I know what building that is, yep.
yeah.
As you're going to the Moose, is that the,
Yep.
is the building right before you get to the Moose?
Yes, sir.
That's the old Fernwood there.
Okay.
Yep.
Yeah. Before my time.
Yep.
What was it?
They called it the Fernwood.
A restaurant?
No, it was like a nightclub. The Drifters appeared there at one time, the musical group, the
Oh,
Drifters.
yeah, I remember them.
Onto the boardwalk and Save the Last Dance for Me.
Yeah.
They came there at one time.
Oh.
Now, I have a good question for you. I went on Facebook and I would go to the VA. The doctor mentioned to me, like, some people, I like music, and they say music is a very good therapy for senior citizens. It brings back memories. It helps them. How do you feel about people being hooked on certain things, like music or something else?
Well,
What are good hobbies for seniors? There's something I like to ask you.
Well, I'll tell you, I think music is great therapy, and it's a great spirit lifter. It lifts the spirit. And there are all different kinds of music. You might want to listen in the morning to hymns, or you might want to listen to a sort of a quiet meditational music. In the
Easy
middle of the
listening
day,
is-
maybe you want
right.
rock and roll, and then maybe you want a more quiet music at the end of the day. There's a documentary called Alive Inside, and that documentary is about Alzheimer patients. I am the co-chairperson for the Metro East Alzheimer Partnership, and I'm actually doing the walk in September. And this documentary, they found out, you know that music that you download?
Yep.
If they download it on a little machine called the iPod, they can give one to individually. They can download music that a particular person would like. So maybe one person likes meditational music, maybe the other person likes hymns, and they can put their preferred music right on there with the earphones, so they're the only ones hearing it, and it calms them, it quiets them. Even for patients that are high psych patients, it's very soothing and very calming. I can't say enough about it. Music is great therapy.
I agree with you, and
And even to exercise with music, it
Oh,
doesn't
yeah.
really feel so much like you're working because you're having a good time and you're in the rhythm.
before I put down what we were talking about here, and when I went to the computer, they just showed the exercise to certain songs where people are jumping up with their hand. Well, I can't do that. I'm level here cricking and cracking, but they were doing all that stuff there. So
Yeah, oh no, music is a great, and dancing. You know, for every doctor that I've had on my shows or taken out into the community, whether they're talking about feet or whether they're talking about brains, every single doctor says the #1 prevention to any disease is exercise. Because if we don't move it, we
lose it.
lose it. And that's true of the body and that's true of the mind. We have to keep moving. And the second,
It's funny you talk about the minds. My wife, every morning she says, Morris, you should have been twins. I says, why? She says, you're too stupid for one person.
I knew we weren't going to get through this without a joke.
Well, she likes to joke too once in a while.
Right. So the second prevention to any disease is, I would have expected it to be diet, but actually it's socialization. That is how important it is for us to come together, come out, be with each other, talk to each other, share things with each other. That's the #2 prevention to any disease. So for the folks out there listening, and many of them are, of course, if they're listening, they're probably in their own homes, and hopefully they're connected to some sort of a community, whether it's a senior center.
I was going to mention that.
Yep. Whether it's a senior center, and they have a lot of things going on at the senior center.
Oh,
these
yes.
days.
Oh, yes. They have bocce.
Oh.
They have Zumba.
Zumba. Yeah.
Zumba. They have
Yeah.
sewing, porcelain classes.
Ceramics and things like that. do they?
Exactly. Yep.
Yeah.
So, and movies too. By the way, everyone say we have to let one of the latest movies at the senior center, and it's all free.
Wow.
So if the seniors out there are listening to you, Roberta, which is nice, I hope they come down to our senior center at 25 Winthrop Avenue, and we hope to have you there too.
I'd love to come there.
Well, our director, Mr. Fielding, as soon as he comes back, I will mention that I had you on the show, and I have your number, I have his number, and I will make sure that you come down and speak to us.
That'd be wonderful.
And
Thank
if the
you.
seniors have any questions, oh, it's an honor to have you here. It really is.
Thank
We
you.
got about 4 minutes left. Miles, why don't you take a minute and a half and tell us something about yourself?
I mean, you
You-
know me
you-
pretty well,
you-
Morris. What do you? Just,
You work for the city. You
Yeah.
were Mayor Rizzo's chief of staff.
Yeah.
You were great to the veterans, great to the people of Revere.
yeah, I'm a board member on Revere TV, and I kind of just like hanging out with you. So I just wanted to come on the show and talk about what I do now. And Roberta's very active with CHA, and she's more knowledgeable than I am because I only started a few months ago. So
Right.
I'm glad to hang out with you, Morris. That's mainly the priority of my day today.
Well, you were a
And you're a
good.
great straight man for Morris.
No, but you were a great teacher to me, Miles. I got to say thank you again.
No problem, Morris. No problem.
I got to tell you, when I first came over to him, I had the earplugs on. He comes over to me, he says, what are you listening? And he's watching me on the computer. And I got one song, and I say, gee, I wish I could keep that song, because I love that song. It's a German song, but I loved it. But once it plays, you don't see it anymore. So he said to me, let me show you how you do this, and he showed me how to save the song. Yep, to make, then he came over to me, and I got to say this, Miles, don't be embarrassed. Don't be embarrassed,
I'm not worried about it.
because you changed my life for the best, really,
Okay.
for the best. He showed me a playlist. He says, you come down to the playlist, type in what you want, and then push enter, and that song will be there for you all the time, and he was right. So I said to him, well, how many playlists can I have? He said, as many as you want. And that was the thing. And I do have as many as I
Yeah.
want.
You took it literally.
That's living proof, because I do a lot of presentations out in the communities, and one thing I'm always saying to people is that two things. If you want to keep the disease of Alzheimer's away, learn something new every day.
Right.
Number one. But number two, you're never too old to learn new things.
I have
we
to
can learn at any age.
Yeah, but I could have learned this 30 years ago. I wouldn't go near this thing. To me, it was like a cobra standing in front of me. I kept backing away,
Yeah.
right? I never realized that once you get onto it, like when I'm home alone sometimes, I go on Facebook or Twitter, and I talk to people, or I degrade people
Yeah,
sometimes.
you tweeted me last week. I was like, what is going on? Why is Morris on
Right.
Twitter? Oh my God.
Okay, I want to say we got about a minute and a half. Miles, just take about 30 seconds to say whatever you wish.
No, let Roberta say it.
Roberta, take a minute, whatever you wish to wrap it up with.
Okay,
'Cause
well, I
you-
just want to thank you for having us on and allowing us to tell the people of Revere all of the programs and the good work that the Cambridge Health Alliance is doing in the Revere area and also in other areas. And I'm looking forward to coming to the Senior Center, and maybe I can do some work with the people individually there. Which
We'd
would
love
be
to have
wonderful.
you, and I'll mention that to the director, Mr. Fielder, who does a great job for us, because he's fairly new there, and he's done not a great job, an excellent job. And he's got a lot of people coming in, and we'd love to have you come.
Well, I'd love to. Thank you very much.
So, Miles, I want to thank you for coming on Revere TV
Anytime,
and the
Morris.
community. It was an honor
Anytime.
to have you. And you too, Roberta and Mrs.
Thank you.
Robinson. Thank you very, very much for coming on.
You're quite
God
welcome.
bless both of you. But most of all, God bless our troops and the people of Revere and the great country, the United States of America. Thank you, folks, for listening. Until the next time we meet again, another great show. Thank you.